Hi there, I'm Richard Laubenberg from Yellowgazebo Natural Healthcare in Toronto. We're located at 804 St. Clair Avenue West. I'm a registered acupuncturist and TCM practitioner. I'm here today with our physiotherapist, Amy Gildner. Hi, Amy.
Hi, Richard.
How are you today?
Good, how are you?
We're going to talk today, as you know, Amy, we're going to talk about lower back pain and physiotherapy. Physiotherapy for lower back pain. So, tell me, what of the people that come to see you for lower back pain, can you describe it? Is there a usual type of lower back pain that you see?
No, and the interesting thing about low back pain is I find no matter what someone comes to me with, whether it's neck pain or shoulder pain or low back pain, obviously, I think every single person in the world can say, actually, at one point in my life, I did have a little bit of low back stiffness or soreness, regardless of what condition they're actually coming to me with.
That makes sense.
So the honest answer is there's no predominant type of low back pain. There's no one kind that I see more often than another.
Right.
It varies between people. Sometimes the same condition can show up completely different in two different people. So there's no one type.
Now, I'm going to ask you something that I know the answer to, but what's the difference? Can you explain, please, what the difference is between low back pain and sciatica?
Right. So often confused. Sciatica is a neurological condition involving a tight muscle that's a little bit lower down. There's a tight muscle called the piriformis. It's hidden behind one of your glutes. That's the true cause of sciatica, is the sciatic nerve that runs down the back of the leg. Gets impinged by the piriformis due to habitual bad posture, sitting, lots of running. Pregnancy causes it. Multiple factors cause sciatica. That is not true low back pain. It's a bit lower down. It's more of a neurological condition, like I mentioned. Low back pain, as I alluded to before, can be from so many different things. However, they're not exclusively different. If you have sciatica, you can definitely have low back pain. You normally do, or you can have one or the other. Most of the time, I see both of them combined. Yeah.
Right. Yeah, that makes sense. Okay, great. So tell me, what do you do when someone comes to you and they say, I have a pain in my back? What do you do?
Right, so I have to do a pretty thorough assessment because it can be complicated. Sometimes it is only coming from the low back and it's purely muscular, and I can palpate and I say, yep, this is the tense area, there's a trigger point, a muscle knot, whatever you may call it, and it's, like I said, purely muscular. Then I would do some manual hands-on treatment, maybe a bit of acupuncture. I could also refer to you for acupuncture. I would definitely give them exercises. Core strength is so important in prevention of low back pain. So I would do that based on the assessment.
And what do you mean by core strength? So are you going to give them sit-ups to do?
No, sit-ups. Right. Never give anyone sit-ups.
You hear that? If you have low back pain, don't do sit-ups, please.
No. I would, again, assess the abdominal strength. I have a couple tests that I use.
Okay.
Yeah, and most of the time, low back is compensating for a weak core. So if you think of it in terms of a seesaw, the analogy I use, the low back, the abdominals should be equal in strength to keep you vertical. Okay, that makes sense?
Yep.
Most of the time, though, the low back is very dominant. The low back is the fat kid sitting at the seesaw, and then your abs most of the time are not as strong, so they're the little scrawny kid.
Get tilted.
Yeah, so the hips get tilted. You go into an extreme curve of the back, and that causes your muscular low back pain. So how you counteract that is, again, like I said, I get some manual treatment in there. I release that muscle in the back, but then also teach you how to strengthen the core appropriately to make that seesaw level again.
That's great.
But the other type of low back pain, there's multiple kinds, but the one most common I see, apart from the muscular, is a herniated disc. So when a disc is slipped, slip disc is probably the most common term people use.
Yeah.
That's more neurological, so I can only determine that based on my assessment, and then that's a different treatment approach entirely compared to the muscular low back pain. So the answer to how I treat low back pain depends on the assessment, and then we'll go from there.
Makes sense. Herniated discs, slip discs, muscular back pain. There's sciatica, so much.
No shortage of back pain.
Piriformis syndrome. Okay, great. Well, just before we go, is there anything you want to add? Is anything you want to just say?
Yeah, I think the most important take-home message from all this should be that you don't have to experience low back pain. You can stay ideally pain-free your whole life. Again, it goes back to prevention. So again, it goes back to see a physio before you have pain. I'll find pain, likely. I'll find something that hurts on you.
Sure.
I will identify something.
Yep.
So the biggest take-home for low back pain is stop it before it begins. Strengthen your core, make sure you're doing your exercises appropriately, and don't do sit-ups.
There you go. So you have no good reason to not see Amy. She's amazing, clearly, and very intelligent. Thanks so much, Amy.
Thank you.
All right, and if you have any questions or concerns, we'll have info following the video. And please give us a call, give us an email, and come see us.